This week's guest on C-SPAN's Newsmakers program is Wyoming Senator John Barrasso. This week on Wednesday, Senate Republicans unanimously elected him vice chair of their conference following Alaska Senator Lisa Murkowski's resignation from that post. A doctor, Senator Barrasso is also the Senate Republicans' point person on health care. Senator, thank you for being here.
Thank you, Susan.
We're going to turn right to our questioners, and let me introduce them. Terrence Samuel is the new managing editor for Congress at National Journal. Terry, thanks for being here. And Carrie Budoff-Brown is the national politics reporter for Politico. And Terrence Samuel, we're going to start with you.
Senator, congratulations on your new leadership position. And let's get right to, I guess, the question of the midterms and the expectations that Republicans seem to have that this is going to be a good year for Republicans. Can you tell us a little bit about how you're either preparing for this or tamping down expectations, which I've heard is beginning to happen in terms of whether Republicans can take control of the Senate?
Well, if the election were held today, I think it'd be a very good day. People all around the country, and the polls show, are very concerned because Washington hasn't been listening. And we have a government that spends too much, borrows too much, and is growing bigger every day. And in states all around the country, as the poll numbers show, that is a message that is resonating back home and here. And we hear it. I hear it every weekend in Wyoming. And that's why I go home every weekend, to go listen to what the people have to say. But as you look at some of these poll numbers around the country, if those elections were today, we'd do very well east to west.
Would the Republicans take over the Senate?
Well, I'm not going to make those kind of predictions. The elections are still at 6 weeks or so away. That's hard to tell. There are a number of races, and you know, I mean, you write about this for Politico every day, a number of toss-up races, but the enthusiasm and the energy is clearly on the side of people who have a conservative approach to things, which in America just says, let's live within our means, let's not spend more than what we have, let's balance our budgets. Families have to do that. Washington needs to do that, and Washington has gotten it wrong for the last 2 years.
Speaking of campaign promises and health care, the area you're very involved in, Republicans are running on a platform of repealing and replacing the health care law. But it seems that until you have a Republican in the White House, it seems it's unlikely to be that Republicans will be able to make a serious dent in the health care law. What can the GOP really do in the next 2 years to make good on that promise, given that the votes may not be there for you and you certainly don't have the White House on your side? What can you really do on this front? And
I think your article today, as well as yesterday, the last couple of days in Politico, was such that you got it right. There are lots of promises made by the Obama administration about what people would expect or should expect, and those promises were not in any way fulfilled. That's why the American people overwhelmingly want to have this bill repealed and replaced. 61% of people in this Rasmussen poll said repeal and replace. Now, realistically, with the president in the White House, no matter how successful the Republicans are this year, you're really talking about elections in 2010 as well as 2012. And the Senate in 2012, in terms of who's up for running that year, you have many more Democrats at risk seats. So I think 2012 has been the year that was supposed to be a big year for Republicans. And if that follows through, then Barack Obama will be a one-term president. Then you can really have a president there who will sign the kind of things that we need to have signed. But I would expect the president to veto. But there are things specifically you can do right now to chip away at this piece by piece, to strangle off this big healthcare takeover by the government, and we can specifically get into those if you'd like.
Senator, can you talk a little bit about the dynamics of the Senate? Now, there is a Democratic president in the White House. The Democrats have a huge majority in the Senate, and still we find that they've had a lot of difficulty getting anything done. Even if you do very well this year, and you either take control and have a narrow majority, or, as a lot of people expect, do very well and have much closer minority. Does anything get done in this Senate in the kind of climate that we have in Washington?
I'd like to see things get done. You know, when we have a 59-41 Senate with the Democrats in charge, the president in the White House, rather than working together with Republicans to find common ground and to find solutions that will best work for the American people, because we do need health care reform in this country. But on that and so many issues, Harry Reid and the Democrats said, you know, if we can just pick off one. Nobody was he was not looking for consensus. You know, you take a look at the days when people would overwhelmingly kind of get together, find consensus, bills would pass with 70 or 80 senators supporting those bills. That's how it was when I was in the state Senate in Wyoming. We found common ground. But this administration and under Harry Reid's leadership, his goal has always been to try to say, let's see if I can just pick off one. I'm only looking to get to 60. And I want to go as far to the left as I can, but as long as I can just take one with me and get our 60 to add to his 59, that was, I think, the approach that they took, which isn't good for America, and it's not good for bipartisan coming together. So if you have a more balanced membership in the Senate, Republican, Democrat, you know, the hope is that then the president seems, hey, got to move more to the middle instead of the far left positions that he's been taking, so we can move the country ahead.
How about the argument, obviously coming from Democrats, that you have a Democratic president, a huge Democratic year in 2008, 59 Democratic senators, on some days 60. Why was it not possible for them to do the things they did or promise that they would do, given that they had such a huge majority and such backing in the public?
I think, Terry, because the positions they took were so extreme. They went so far out of the mainstream. The Founding Fathers, when they set this up, you know, wanted the Senate to be, you know, the area to kind of let the coffee cool and to let things cool down so they wouldn't overreact. So there are all of the mechanisms set up in the Senate. The Senate is set to play defense, to stop bad ideas from happening. And that's a lot of what I see our role has been, and mine specifically, in the last year and a half, 2 years in this administration, is to try to stop bad ideas from becoming law. And that's how the Senate structurally is set, so that people ought to be working together for solutions that are in the best interest of the country.
Well, staying inside baseball and the dynamics of the Senate, if you do retake the majority, do you support filibuster reform?
You know, no matter who is in the minority, always favors the filibuster. This has been set up in a way by our Founding Fathers a long time ago to say we need to have a way to slow things down, to not get carried away. And I think the rules have worked well. You know, this isn't something that's brand new. This is something that's been in place, specifically the filibuster, for a long, long time.
Well, the modern filibuster has certainly changed in and how it's applied in recent years. Do you think it's working for the Senate and for the country?
Well, it used to be 67 votes to break a filibuster. Now it's only 60, so it's actually the easiest right now. One of the differences is that a number of years ago you actually had to go and talk for all of that period of time. Now they can have it without the long speeches, but that was quite a historic time, and it's, you know, Mr. Smith goes to Washington, the long filibusters. I'd be willing to talk, though.
Carrie Brown?
Some of your Republican colleagues have suggested that if Republicans do gain control of Congress, that a government shutdown may be in the offing. Specifically for health care reform, this is being talked about, the idea of putting restrictions on appropriations funding for HHS or the IRS to implement this law. Is it worth shutting down the government over anything in the next 2 years in a Republican-controlled Congress, you know, specifically over health care reform, given how much it's disliked by members of your party? Is a government shutdown something you would?
That's a bit of a hypothetical. What I would like to do is see us choking off some of this money that's supposed to go to the Internal Revenue Service. They're needing or asking for $10 billion to fund hiring up to, what, 16,000 new IRS agents to implement what's in this health care law that says every individual needs to buy health insurance. And the IRS is given the job of going out there and checking to make sure that each one of your viewers today has health insurance. So they need IRS agents to do that. And if they don't have the money, they're not going to be able to implement that. They're also the mandate that businesses supply health insurance. So I think there are areas that you can limit money going to agencies. The same with the Health and Human Services budget. They need about $10 billion to try to go through all the rules and the regulations. I can think of ways to try to stop that money from going to those specific agencies, the Internal Revenue Service, Health and Human Services. But there are a number of areas, and I can think of 5 that I'd go after with the health care law in efforts to repeal and replace. Look at this. It's called the Class Act. It has to do with long-term care. It's in the first 10 years of the bill. They give out no services. The whole goal is to bring in money. Even Kent Conrad from North Dakota, Democrat, called it a Ponzi scheme that you know, would make what Bernie Madoff did look minimal, it's that bad, we ought to repeal that. I think states ought to be able to opt out of this. Nancy Pelosi said so in any given state they could decide whether they want to be part of the rules and regulations or just eliminate that. Nancy Pelosi said you don't get to find it, you have to pass the bill first before you get to find out what's in it. Well, I mean, you think about that. People are finding out what's in it. This whole IRS regulation that has to do with these 1099s, all these small businesses in the country, 40 million of them are going to have to fill out all these additional 1099 forms to anybody out there who they buy or sell from. It's it's going to cost billions of dollars in expenses, and nobody saw that coming until after the law was passed.
Would you sign a pledge? There's a group called defundit.org. They're trying to get pledges from members of Congress to agree to defund the health care law. Would you sign such a pledge?
I'd have to take a look at it.
So, staying on health care, but on the politics of it, which obviously has been driving so much of the discussion over the last couple of years. Now, it's passed after a very long and difficult process. Why is it not then that the system worked in that situation as well? And can you, I mean, you were working to the extent that it happened at all closely with the White House on this issue. What happened? I remember one event where you guys went to the White House, Senate Republicans, and came back completely upset and said that you were being used as props. And that meeting seemed to me to signal a complete change in how that process went. Why were you not able to work on an issue that was so important to the country and get it done when it seemed so clearly at the top of the list of priorities?
Well, I think that's a perfect question, and also it brings to the question is why is the public so upset? Because all of this that the president had said, this will be shown on C-SPAN. He said these deliberations and discussions would be held on C-SPAN. Everything was done behind closed doors. You had the Senate Health Committee bill come together, the Finance Committee, and then what did Harry Reid do? He went and took both of those bills into his office, closed the door, and he and just a couple of people, including Rahm Emanuel, came out with this, 2,000-page health care bill that left things out that had been through the Finance Committee that were in both bills, the Health Committee bill and the Finance Committee, let them out completely. Other things that weren't in either bill, it came through. None of this was in public debate. None of these were in open meetings. So you do all these closed-door meetings, and then at the end, you cram in things like the Cornhusker kickback with a special deal from Nebraska, the thing called Gatorade, the special carve-out for people from Florida, the $100 million for a place in Connecticut, and I think there were 13 different special deals that went for different members of the Democratic Party to get their vote on this. They say don't watch the sausage being made. Well, one, the American people weren't allowed to see it, but were able to see what was happening to a degree, and people were screaming, no, don't pass this. So we had this incredible opportunity, and you had at the same time the economy doing so poorly, and the president who said he was going to focus on jobs and the economy didn't. He spent a full year of his first 2 years in office on health care, ignoring jobs, the economy, the debt, the spending. And the big promise is that if you like the health care you have, you can keep it. Now the Washington regulations from the White House say 51% of people that get out their health care through work aren't going to be able to keep what they have, even if they like it. He said we were going to get the cost of care down. Kathleen Sebelius said insurance premiums will drop 10 to 20% when this passes. We're seeing premiums go up. So, on item after item, and he said this is going to help, save money and cut the deficit. And now the new talking points of the Democrats said, hey, don't mention that because nobody believes it. So you have the president making all these promises. The realities are very different, which is why Kerry's recent article in Politico that even quoted Bill Clinton, who said, oh, people will love this. Now, Bill Clinton last week on Meet the Press said, I was wrong.
Halfway through.
Did the president have any option, which is the claim they make all the time, that there was no negotiating option with Republicans, and hence the debate having to take place almost entirely within the Democratic side of the...
Well, I think there were lengthy discussions. The Finance Committee with Senator Enzi from Wyoming and Senator Grassley and Senator Hatch. Olympia Snowe was very much a part of these discussions, and they all ultimately voted against what was crammed into the bill. Members of Congress on the Democrat side didn't even want to have to live under this plan. And then, I kept calling for the president to please put somebody in charge of Medicare and Medicaid for the country. If you have a health care bill on the floor that cuts $500 billion from our seniors on Medicare and puts 16 million more people on Medicaid, there should be somebody who's the director of that program for the country who could then come to Congress and answer some questions like, what are the impact going to be on our Medicare patients if you cut $500 billion from them? What are the impact going to be of people on Medicaid in our hospitals and the healthcare providers if you cram 16 million more people onto Medicaid, a program that is very badly broken and many doctors won't even see those patients? The president, for a year, refused to appoint anybody. He finally named somebody after this was signed into law, and then does a recess appointment so that that individual, Donald Berwick, has still never come to Congress to explain to the American people his quotes about rationing care, about his love of the national health care system, the British health care system, and about a health care system designed to redistribute wealth. And I think the American people want to have answers to all of those things, and that's why this continues to be so unpopular.
Two of your Republican colleagues, Representative Paul Ryan and Senator Judd Gregg, said Wednesday in an interview with CNBC that reconciliation would be an effective tool to use to repeal parts of the health care law. They endorsed reconciliation, but that's a tool that you can use to get around 60 votes, use 51 votes in the Senate. That was very, very highly criticized by Republicans during the health care debate. Is that something that you could see using reconciliation to pull back elements of the healthcare law?
Yeah, I haven't looked into that aspect of it, but there are a number of different aspects that we ought to be taking out of the healthcare bill, looking at limiting the funds for the IRS, looking at limiting the funds for Health and Human Services.
But you won't
and I'm
commit
not sure
to
about the reconciliation. I'd have to look and see what would.
One specific question about insurance policy and the healthcare law. There are aspects of it which seem to be popular with the public. Portability, also the lifetime caps raised, and pre-existing conditions. How does the system fund those popular aspects without a universal mandate?
Yeah. Well, in Wyoming, we've had a state-run pool for high-risk people with pre-existing conditions. It was more expensive than other insurance, but it was something that we could work with people, and we had subsidies, and it worked well in that state, and 20-some states had something like that. Now this administration has come out with their plan that's, as you say, a potentially popular part of this, but for people who have been doing it right all along with pre-existing conditions as part of these state plans, they're not eligible. They're not eligible at all for what's come through this health care law. The only way you can be eligible for this is if you've been without any insurance for 6 months. So if you have somebody that's been paying a higher rate, because the new law says, well, it has to be down at the rate of everyone else. If you have people that have been paying a higher rate, scraping by, and these are expensive rates, but paying, they get no benefit from the health care law. The only people that benefit are those who haven't been acting in, as what some might say was a responsible way of trying to get insurance, and so they're going to keep paying up here, and it's only for people who have had no insurance for 6 months that are going to be helped by this. So there are huge, inequities in this, and there are a number of things that kicked in just this past week. And the president had a backyard meeting, and it talked about some of those which are supposed to be the popular. This week, USA Today had an article about what they were, and said this is the popular part of it, and then underneath long paragraphs called "Be aware." So the issue you talked about lifetime caps, if you know about that, well, but be aware. It's very likely that if you want to raise that, limit lifetime amounts, or not limit it, then you're all going to pay more. So all of the things, in terms of the things that are even supposed to be the good things that are going into effect, have lots of be aware with, and that's why still today 61% of American people want this health care law repealed and replaced.
We have 6 minutes left.
Senator, can we talk a little bit about the turmoil in the party, in your party? Your new leadership position is in some ways reflective of what happened in Alaska, where an incumbent senator has been beaten in a primary. We've seen the primary results in Delaware. What is it that's happening in the Republican Party that allows Mike Castle with a long record to lose to Christine O'Donnell. And how does that bode for the party going into the 112th Congress when you guys return next year?
There are a lot of energized people all across the country who are concerned with a government that spends too much, borrows too much, and grows bigger every day. That's what people across this country are seeing.
But some of them blame your party for that. The anger on the Republican side of the fence, in this case, is in some ways a reflection of people being upset at what happened during the Bush years, and clearly what's happening during the Obama years. But are they taking this out on some of your party members in a way that you didn't expect?
Well, if you take a look at the voting record of, say, Mike Castle, he voted for cap and trade, for a number of things. And I think that it's really an issue of what are we spending money on? How are we spending it? Are people getting value for their dollars? And people around the country don't believe that they're getting value for their tax dollars. We are completely united in the Senate behind all of the nominees of our party, and that is our goal, is to get them elected come the fall. We're all working together and working for our nominees. And in Alaska, that's Joe Miller. He's the nominee of the Republican Party and has the full support of the Republican conference.
Mike Castle is said to be pondering a write-in bid in Delaware. Would you encourage him or discourage him from that?
Well, the people of Delaware have spoken in the Republican primary, and our nominee is there. It's Ms. O'Donnell, and that's who we'll be supporting.
Okay.
There's on immigration reform, Republican potential nominees for president in 2012. Mitt Romney, we've reported that he has tried talking with some members of Congress to say we need to get immigration reform off the table by 2012, or else Republicans could face some trouble in the Southwest. You can't win the White House without, picking up Nevada and some other, Arizona, potentially Florida. That if the Republican Party continues running on a platform in which, it's not viewed as amenable to what immigration advocates want, that could pose some problems for a Republican nominee in 2012. Have you heard of that at all, that it will be a problem for a Republican candidate in 2012 if immigration reform is not dealt with? Will that at all create a likelihood that Republicans will want to take immigration reform off the table in the next 2 years to get it out of the election equation for a Republican candidate?
I haven't heard that at all. I mean, when you talk about immigration reform, to me the issue that I hear about all the time is illegal immigration. I mean, we're a nation of immigrants, people that have come here legally. The issue is people that come here illegally and how to deal with that. And now there's this memorandum from Homeland Security about ways to allow people that are here illegally to stay here. About an 11-page report that Senator Grassley from Iowa was able to obtain, and we need answers from that from this administration, Homeland Security, because it clearly violates the law. We need secure borders. I've been to the border. The border is not secure, and that's a big problem right now, and I think that is what's driving this debate and the discussion is, first, we need to secure the border. Then you can have the rest of the debate.
Senator, your recent election to the House leadership, the Senate leadership, is an indication of a certain rapidity of your ascent in the Senate. Can you talk a little bit about what you hope to do in this job, given that you know how the Senate works, you know that it is meant to play defense and not offense, and you have, I think, what will be a new class of people doing what new classes always do. They want to come, they want to change the world. What is your role in trying to help them navigate this very unfamiliar?
I was the chief of staff at a hospital, the Wyoming Medical Center, and we had 100 doctors on the staff, and you have the different personalities, different egos. You have the pediatricians and the psychiatrists and the brain surgeons and heart surgeons, and we're all different. But all of the doctors wanted to do a good job for patients, and I think all of the senators and the new ones coming in want to do a good job for this country. They have
they're all surgeons, though.
Well, I was the surgeon too, so I'm looking forward to working with all of them. But there is common success that we will have as we continue to talk about a message that is that this government and this administration spends too much, borrows too much, grows too big every day, and we need to get the spending under control. We have to limit the spending. The American people get it. I mean, they're worried with this debt and this deficit. And you raised the issue of a previous administration. This president, if you look at all the money, all the debt that has accumulated from the time George Washington began as president till the time George W. Bush left the White House, this president has doubled that debt in 5 years, tripling it in 10 when you look at his budget. I mean, that's irresponsible. It is unsustainable. And I think what we're seeing all across the country is people are worried that this is actually irreversible. And they're saying, we need our country back. We have to rein this in because we can't continue spending each year where 41 cents of every dollar we spend this year is borrowed from China. You can't do it.
We are over time, but let me just ask you as we close here, handicap what you think will happen with the tax debate.
I think you should never raise taxes at the time of a recession, and that's going to be, I know, my position and that of my colleagues. We'll see if Senator Reid brings it to the Senate. He's the majority leader. He gets to decide what comes to the Senate floor, but I think you shouldn't raise taxes on anyone during a recession.
And one last issue, the START treaty.
As you know, I voted against it,
I do.
And it had to do with missile defense. I've been to Russia earlier this year, been to Moscow, been to St. Petersburg. I have concerns. I agree with Ronald Reagan, trust but verify. And there are parts of the preamble and parts of the treaty that says we would not be able to continue to defend ourselves as a nation. To me, the START treaty is supposed to be about how many nuclear weapons we have, how many the Russians have, not about how we can defend ourselves. When you have North Korea, you have Iran with possible nuclear capabilities coming down the line, we need to defend ourselves against everybody, not just focus on the Russians. So I don't think we should limit our defense, and that's my concern, and that's why I voted against it.
Thank you for being with us this week.
Thank you. Thanks, Susan. Thanks, Terry. Thanks, Terry.
Thank you.